Hi, I'm Veronica Montgomery, and I'm the Clinic and Patient Liaison Consultant here at the Fertility Hub. The Fertility Hub is a one-stop resource for both patients looking for advice and information on fertility treatments and also for healthcare professionals. We have a locked area of the site specifically for people working in assisted reproduction. Within that section, we have Managing an IVF Unit, which is a weekly blog on all aspects of running a unit. However, throughout the current COVID-19 pandemic, many clinics have had to suspend fertility treatments for the foreseeable future. With regard to this, I've now started a new weekly blog on a Wednesday, which specifically looks at crisis management, marketing and communications throughout this period of lockdown. This week's blog looked at the financial implications of COVID-19, and within this blog I've looked at already within a couple of weeks the unemployment figures for both the UK and the USA. I've then taken a case study which looked at the economic recession in Greece and specifically looked at the effects on assisted reproduction throughout that economic downturn. There's also been a study on the Great Recession, the financial crash of 2008, and I've also looked at another paper that was specifically looking at in vitro fertilisation services throughout the United States. One big topic that we talk about within this blog is pricing, and we know from the Great Recession that we saw US IVF clinics having to dramatically slash their prices to compete for the patients. So we'll look at a little bit about that. We also look at the financial implications from a patient perspective and how that affects their method of payment and whether or not they can actually afford treatment when we come out of this. Also look at the clinic perspective. Obviously, there's no revenue stream when you're not actually performing procedures. I also talk about the marketing budget and what you should be doing during this crisis and ways to make that work. Specifically, something we're going to be launching in the next week is that we've come up with a few ideas of how we can help both patients and clinics get through this tough time, especially when we have no agenda of when we might actually come out of this lockdown phase. We also talk about involving the team in decisions you're going to make regarding the clinic and the future of the clinic. In the coming weeks, I will also be looking at marketing methods such as your PR, your brand, your online marketing, webinars, seminars, newsletters, videos and podcasts. If you'd like to discuss any of these topics that I've talked about each week and will be producing each Wednesday, my contact details are in the blog and you'll also find a link to the blog just below. Thank you very much for listening and please stay safe, especially if you're working on the front line, and I look forward to speaking to you soon. Thanks.